Okay.
Afternoon, everyone. Might as well get ourselves underway. Our speaker today, as you know, is Margaret Carney, who is the Chief Executive Officer of Sefton Council. And for those of you who don't follow how local government works here, this is part of the Liverpool City region, and there are many points of contact now between the school and the Liverpool City region, particularly because the research strengths of the various universities in the city are realised by the city as a potential driver of future economic growth. So, for example, there is a local enterprise partnership here which maps pretty well onto the Liverpool City region footprint. Margaret and I both sit on the Life Sciences board of that LEP, and it was there that I heard her give a talk, much the same as she will give today, on the health difficulties that her particular area of responsibility faces. And it struck me that the challenges faced in Sefton are actually not that too dissimilar from the health challenges that we deal with in low-income countries, and I felt that you'd be interested to hear what she would have to say. So over to you, Margaret.
Thank you, Peter. Good afternoon, everyone. My day job is the Chief Exec of Sefton Council, but they give me a bit of a sideline as well. So I'm the lead Chief Exec for health, wellbeing and social care within the Liverpool City region, and I'll just give you some of the facts around that in a little bit for those of you that maybe think, what the hell is Liverpool City region? So I'll run through that in a little bit, but first of all, just want to say, you know, how grateful I am to Peter for inviting me today, and for the school. I was saying to some colleagues before that the last time I was in this building was probably the early 80s, when a friend of mine was a nurse in the city, and this was the nurse accommodation. So I suspect that absolutely. So I expect that there was more to learn about public health in those days in a nurses' school in the middle of Liverpool City, as there are today. But also just wanted to say how immensely proud the city and the boroughs are of the school, in terms of the work that's done here, in terms of the research that's done here. Absolutely, you know, if we use the term world class a lot these days, but if there was one word to describe the school, then it would be world class. And of course, amongst all of those firsts for Liverpool, I know, I was told, there's some rivalry between yourselves and the London School, and if possible I should make sure that I say that you're absolutely the first, alongside the first public library and the first public baths, so recognise that. So let me just kick off then. What I want to do today is just to give you some of the overview of the challenges that the Liverpool City region faces in terms of the health and well-being, but I don't want to dwell on the kind of the stats of shame too much, but perhaps take it from an angle of what those opportunities are as well, and the positivity within which people are engaging with that agenda. And I also want to cover the democratic process that happens, but want to focus on what the role of communities is within that as well. So hopefully, if the technology works, this is the Liverpool City region. It isn't the city of Liverpool, it is the 6 boroughs, very independent boroughs, that surround it, and why it comes together. It's a political and economic construct, so it is based around the politics of those 6 boroughs, and it is a natural travel to work area, so there's a strong economic focus to it. Those labour and housing markets, people crisscross this area throughout the course of their day and throughout the course of their lives, so there's very interconnected systems. There's a real shared political ambition to improve health and well-being, and that sits, in my view, at the top of the list. And by that I don't mean the access to health services, as important as that is. I mean truly the widest definition of health and well-being and health and happiness. Obviously it's an area of tremendous historical and current culture of innovation and creativity, and interconnected public services, and that's important for a political construct in order to make sure that we're achieving the most efficient and effective ways of doing things. So the 6 boroughs working together in order to improve the health and well-being of the communities. We certainly have economic challenges. So low gross value added, in effect the profit that is made, the social profit that is made. Of the whole country, we have the second lowest of that, and that's bad. Low employment and high unemployment, but a relatively new concept of underemployment. So this is where people are actually not working as many hours as they would like to, and I don't mean 60 and 70. I mean the prevalence of 0 hours contracts, the prevalence of not knowing whether you've got work to do the next day, people doing 2 and 3 jobs in order to make sure that they have enough income for their household. Long-term sickness, worklessness, skills, household incomes, and of course health and well-being playing its part in terms of people being able to participate in that economy. So high levels of workplace absenteeism, aspiration is something that is absolutely key to this, particularly aspiration of young people, but not exclusively young people. And the cost to the economy of all of this is extremely high. But in addition, it makes businesses less competitive. So if we are looking to create more and better jobs for local people, businesses want to come to an area where there is a high productive workforce with the right skills, with the right attitude in order to locate. So we've got to find a way of balancing up, making people happier and healthier and able to participate in that. And there are some really difficult stats here. People associate poverty and poverty in the UK with being unemployed. 55% of people who are currently working in families live in the official definition of poverty. And that is an absolutely national disgrace, isn't it, to be frank? Poverty, 26% of all children in the Liverpool City region, so those 6 boroughs, live in the official definition of poverty. And most of those are 1 to 5, 0 to 5 children. The demographics is of an increasing, a slightly increasing population, about 2% across the city region. Certainly an ageing population, but a population that isn't ageing well. So living a significant part, about a quarter of their lives in ill health. And lifestyles around alcohol and smoking and diet and exercise results in high levels of long-term sickness, about 30% of the workforce, generally speaking. And that quarter of the life held in poor health. You won't be able to read all of these, but I'm sure that the slides are available. These are just a summary of some of those stats. But those of you that know Merseyrail and maybe travel north to south across the city region, if you take the stops on that train journey that takes you from Hunts Cross up to Southport, these bars represent the average life expectancy of people in those areas. And I'll just point to a couple of this work. So you can see that at the highest, well, you might not be able to, but hopefully you will see at the highest round here, Ainsdale, 85 average life expectancy. Now we're only talking about maybe 8 to 9 miles away. By the time you get to Seaforth and Liverland down here, it's 73. It's a couple of stops on the train, but the average life expectancy is that much different, and that is to do predominantly with people's circumstances in terms of their economic and their levels of deprivation. There will be other factors, there will be genetics and all of that, and you are far better qualified to speak about those things than I am. But predominantly, that is, within, 8 to 10 miles. So we're lower than the average, but between the areas, a fairly tight geographical area, again, in my view, an absolutely national disgrace. So what's some of the work that we're doing, and some of this will be familiar to those people particularly within the public health, pre-birth, the best possible start in life, whether that's in terms of nutrition, stimulation, and opportunity, and parenting, really important. Jobs, in my view, are the most important thing. If people have a job, are economically active, or have activity that is stimulating to them, so volunteering or working in your community, then the chances are your health and well-being will be better. Housing, if your house is safe and warm, if you know where you're going to sleep that night, let alone if when you get there you're able to heat it and to live well. Open spaces and green spaces and connected communities. I was at a session this morning up in Preston with some health and social care chief executives, and we were talking about the importance of community and the definition of community, and really interesting around whether that's the street that you live in. I mean, I don't know how you would define your community. I define my community, I live in an apartment block, I define my community probably as 2 floors of my apartment block. That's my community. To some people it is Liverpool, but what's clear is if you're not connected to that community, then the chances are your health and well-being will be poorer as a result of that. And ill health prevention and accessible health services, really important. We are trying to work at the city region across those range of activities. And this is why it's important. Happy people contribute more and cost less, and that's a very economic argument and ignores the fact around the quality of life, but actually that's why it is important. Just turning then to the Liverpool City region and health and social care, and you may have heard of conversations happening around the takeover of the NHS by local authorities and devolution. I don't know whether any of you have heard or read about that. This is about a £3 billion industry system. It is a big system. And even though we've seen that modest increase in population, actually the bit around the age in population and the age in ill health is really important. So the healthy life expectancy, 58 to 62. What we've got so far is a system that doesn't really deal with that. We have always had that level of health inequality and that poor quality of life. And just to give you an idea, and I've not even included academia in this, but they're the list of organisations and the number of them that are involved in the city region in what might loosely be called health and well-being. So everything from, for 1.5 million people around acute providers. I mean, since I did this presentation just a month or so ago, we've now got 2 extra community mental health providers within the city region because a procurement's just happened. So this number is increasing and diversifying. And what we are saying within the Liverpool City region is we have to find a way of making that simpler and more joined up. I think I'm relatively well informed, and I struggle to find the way through. Who is it? Where do I go? And then what we do is we then find the consequences of that, and people say, oh, so many people turning up at A&E, so many people turning up in the wrong place. Well, when you've got a very, very complex system And if we're not able to communicate and engage with those communities, then that's what will happen. And what we will end up with is people going to the place where they think they're going to get the service, where they think they're going to get that within a reasonable length of time. And I say a 4-hour wait, and people will say to me, well, actually, at least I know I'm going to be seen. You know, I'm prepared to sit for 4 hours because I might have to wait longer if I go elsewhere. So we've got to find a way in which we're simplifying and making this less fragmented. The other thing is it's completely skewed towards ill health. And that's understandable, the acute end of all of our business. So now my business is predominantly social care. In Sefton, I'll use Sefton numbers, we only provide a service to something like 18 to 20% of people over the age of 70. So the rest of the population are either caring for themselves or are being cared for by loved ones and families, by and large. So it's a relatively small number, the tip of any triangle you choose. And the same within the NHS, where the vast majority of the money goes into acute care, important because people need that care. Our argument is that more of that should happen in the community. Now, of course, how do you shift that emphasis? If you've got people who need acute care, they need acute care. But if we're ever going to find a way in which we are having care much closer to people's homes, which is what people say gives them the best quality of life, then we have to find a way in which we shift some of that investment. What we're absolutely sure about is that currently the system is not delivering the kinds of improvements that we would all want to see. And that's nobody's individual fault and no organisational fault. This is a complex relationship between the state, the organisations within the state and individuals. And we've got to find a way in which they are much more in harmony. There is a real risk of market failure in social care. So even if we have that care closer to home, at the moment we are seeing providers who are not prepared to stay as providers in that market, either because it doesn't pay, they can't get the staff with the right skills, the impact of austerity on local government in particular has reduced their income stream. And I think there's a whole question around clinical and financial sustainability of the whole system. So for no other reason, there's no other reason, and I would hope that we would concentrate on the social reason for doing it. Actually, the system probably isn't clinically or financially sustainable. That Liverpool City region, those 6, there's a political construct which is called the Combined Authority. It's, if you like, the council that governs what goes on at that level. It has no legal powers over health or social care. So it is doing this work through influence and engagement. It has powers, the local authorities have powers over public health, but the Combined Authority doesn't. It's predominantly economic focused, and that's why that link between the health and well-being and the relative health and well-being of citizens and communities is important to the Combined Authority. We have, coming back to the comment I made earlier about devolution, opened up a conversation with the government about whether more of the decisions about the health and well-being of people in the Liverpool City region should be taken locally. The Combined Authority has had some of those powers transferred from government on other areas such as transport, on skills, on employment and on regeneration. As yet, none of those powers are transferred. I don't even know whether they ever will be. I have a view, a proposition that is, the more local a decision is made, usually the more relevant that decision is to the people affected by it. Now, what that means in terms of whether, local authority takes that, a combined authority, whether it's a neighbourhood, whatever it might be, is something for discussion as we go through probably the next 2 to 3 years. But that aspiration is to create the most effective health and wellbeing system that will have the best possible chance of improving the health and wellbeing of the people of the Liverpool City region. In order to do that, again, it is our view there needs to be more focus on early intervention and prevention. If we don't, and by that again I don't mean necessarily health intervention and prevention. I said before, it's as important for people to have a job, to have a house, to be connected to their communities, for them to have fulfilling activities, than it is, arguably, except for when you absolutely need it, to have access to health services. But there's definitely complications around footprints and where hospitals are and where community services are that will need to be addressed if we're going to deliver on that. So, tackling fragmented leadership, those all causes, and I said before, the combined authority currently has powers on all of those: housing, employment, air quality, education and skills. So it seems right that if we're looking at this across an all causes issue, that the combined authority has a role to play. But it needs to have really clear lines of accountability. They need to be locally determined, and like it or loathe it, it has a democratic legitimacy. Within the system, there are the local leaders who every 3 years or so put their names forward, and somebody either comes and puts an X against it or doesn't, depending on their policies. That link to economic growth and access to new government money. So the devolution deals that we've got so far has delivered something like £1 billion over the next 5 years. And that's a really significant amount of money that can be invested to improve those life chances of local people. So we can't have a healthy economy if we don't have healthy people. We just can't. It's not possible. Having a good job leads to that better health and well-being, and joining up health and social care should help to make it both easier for people to navigate that, but also easier for us to invest more in that early intervention and prevention. And if it comes under the auspices of the combined authority, bringing those other wider determinants of housing and skills, then I think it's got the best possible chance. We do absolutely need to include the productivity of the workforce. And the economy itself is significant at over £3 billion. So, in conclusion from me, of course access to good health services is important, but actually this agenda is much more than that. I've said the health inequalities is a national disgrace. It is particularly poor in this part of the world, but we're not exclusive in that. So there is a massive gap between those that have good health and well-being and those that don't. This kind of complex system about simplifying it, but ultimately this thing around communities, and I just wanted to end on that, because I think most organisations in this system will have something around building community resilience, building community confidence, self-care, being responsible for your own health and well-being. That's the agenda. That's the kind of the post and current austerity agenda. It's about saying to communities, it's over to you now. We've no longer got the kind of resources that we need to do this, and that's completely the wrong end of the lens, because what we should be doing is to be talking with those communities about what they need from us in order to do that. And I think there's 3 levels to that. There's absolutely the stuff that the state just needs to stay out of, that communities do for themselves. There's the stuff that communities need help with, but actually by and large with that help they will be able to deliver a difference. And then, and only then, is it the things that we need to do for them. And of course For many decades, that's been the other way round. It's been the state can provide all of these services that you need if you're able to access the system. And unless we shift that to the communities, we will not have a sustainable solution both to the health and well-being and economic agenda and to the social agenda. And interestingly, in 1948, the World Health Organization, that hasn't changed for me. It isn't the absence of disease or infirmity, it's about the quality of the life that you live. And that's it from me. I'm very happy to take questions or comments.
Do we have any questions? No, Janet.
So you started off by saying that we've still got a very low GVA. Started off saying we've got a very low GVA. We've been a European regional development region for a very long time. There's a lot of funding come in through that. Why hasn't it shifted it, and what are we going to do differently going forward that we're going to see that shift as we get inward investment come in?
I think a really excellent question. My proposition, because there isn't research on this, and we search and scratch our heads about this, in terms of the billions that's gone into supporting that economic, not just European, but everywhere else. My view is that it's been quite a place-based system. So we've invested in the physical. What we've not done enough of is to invest in the people. So if you just take European resources over the last 10 years, about 75% of those have gone into physical things, about building new things. 25% has gone into people in terms of skills development, roughly speaking, over those 10 years. So what that means is that the growth hasn't been inclusive. Those people closest to the labour market will have got first go with that. And those furthest away are still far away. So what's going to be different, I think, and who knows what happens in a kind of a post-Brexit world, but what I hope will be different is with a devolution agenda, what you've got are those decisions being made much more locally. So the criteria for that resource will be determined and defined locally. Even where European money was devolved under Objective 1 status, it was still under the rules of the European Commission and the national government. So to me, the difference is local people making decisions that will impact on them locally and benefit them locally. And the democratic structure, I think, holds people to account for that. There's going to be a lot less money, I think. So the other angle is how we ensure that we've got the right environment within the city region for private sector investment, which is ultimately going to be the thing that makes the difference, I think, post-Brexit world. And I think for me, that's the skills and the quality of people that we have in the workforce. And I think that's, for me, where we would start to make much more of a difference.
Nick.
So I completely agree with what you said about the importance of making decisions locally, and interested in the idea of democratic legitimacy. That doesn't just come from having a vote on something, it comes from people actually voting on it. So in our last general election, I think, 65% of people voted? Mm-hmm. So when you're talking about a system which is so bewilderingly complex, how do you give people the ability to make an informed decision, and then how do you get them to engage with the democratic process when people don't engage with general elections?
No. Where do you start? I'd put that back in terms of what the role of communities are, and that where you get communities who are really interested and passionate about a particular issue, then communities mobilise in order to make a difference in that community and for that community. At the moment, frankly, our political system is one that people don't want to engage with, either because they don't feel it's relevant to them, or because there's a range of policy issues, some of which they may agree with and some of which they don't. So absolutely, we've got to get to a position where people are passionate about that. I was in an area at Malham up in Cumbria, and the NHS was about to close the hospital, and they came forward and put alternative propositions and worked with the system in order to make sure that was much more relevant. As a result of that community engagement, the turnout at the local election increased significantly, because people saw there was a direct correlation between changes that they wanted to see and the political mandate of the people who were putting themselves up for election. I think it's a huge issue in parts of my own borough. I mean, I'm the returning officer, so I see these things, and in one particular ward in my borough, it will be 18% of people who will go out to vote. And if we're going to truly put the power into communities, then we've got to find a better avenue for them to do that. At the moment, this is the system we've got, that's the democratic system that we've got, and the consequences are what we have. But it's not just the electoral system, so the combined authority meets in public every month. The last meeting we allocated 60-70 million pounds of resource to projects that would improve the economy, and the public gallery is empty. And I really want to find a way in which people get much more engaged, and some of it's really dry stuff, don't get me wrong. I mean, sometimes I don't want to sit through it either. But we've got to find a way in which we spark that interest, and for me it's about finding the issues that are relevant and having policies that people see are going to make a difference.
Alistair.
Maybe I should get out more, but the figure of 30% absenteeism came as quite a shock to me. Are there some major drivers behind that, and what would be the solutions to those?
The drivers are a combination of things, as you would expect. There is some inherent ill health issues. In this part of the world, the legacy of an industrial past leads to some real serious long-term people with long-term conditions. So there's a driver there. The other driver, more recently, we believe, again the evidence yet to come forward, is that concept of underemployment that we spoke about. So if you're not quite sure whether you're going to have any hours to work that week, if you're concerned about whether you can actually afford to feed your family, then the mental health and well-being and stresses on you means that you are unlikely to be fit for work. So you've got that vicious circle. And certainly there's all of that kind of stresses and strains of modern life. So if you look at the reasons for absenteeism, by far the highest one is stress related and mental health. And we've seen very recently a much stronger, and I think a much more positive engagement around mental health and the impact that mental health has. So I think there's a potential solution there in terms of taking seriously how people's mental well-being is impacted by modern day life. It is a really serious issue for the Liverpool City region, and it's one of the causes why employers say to me, if they're thinking of expanding or if they're thinking about coming into the Liverpool City region, they want to make sure they've got a fit and healthy workforce. I think they also have a responsibility to make sure that they keep a fit and healthy workforce. But predominantly the driver is mental health.
Shaba.
I was just a bit shocked with your health, life expectancy figures. They're actually, so if you're for example, a HIV-infected person living in London, the life expectancy is slightly higher than it is in some of those boroughs. So it's quite a shocking statistics. I'm just trying to think, what could be behind that, and I guess the problem there relating to the more non-communicable diseases, the diabetes, hypertension, smoking. They're preventable.
Yes.
It's not easy to prevent, but they are preventable, and it really needs interventions more at a kind of structural level. I just wondered what the council was doing about that. I mean, you say about jobs being really important, but a lot of the benefit from having a job come from all the factors that go in preventing these conditions. So job equals more exercise, better food, so on. So it's just, what do you do about preventing these conditions that really need structural intervention?
Yeah. By structural intervention. So if you take the work that we're currently doing around hypertension, alcohol, and I'm going to get this right, I can't say this word, too many antibiotics. I get kind of, you'll be better at pronouncing that than me. So we've said that those three areas are the areas that across the Liverpool City region we think will have the most impact in the shortest time. So, we know that a massive amount of hypertension goes undiagnosed, and yet it's a relatively quick and simple, if you can get people in, or if they can do it themselves, then treatment is low cost, and actually the benefits are significant. So how do we get people to both recognise that they need to be checked, and then we get the right treatment when they are checked? The alcohol agenda, you just cannot underestimate, particularly in some of those communities, the impact that excessive alcohol consumption has. And it isn't just on people's health and well-being, it is on that absenteeism, it is on crime and disorder, it is on social care. It has a massive impact, and we've got something like 26 to 30% of people in the Liverpool City region who consume more alcohol than the recommended. Not the recommended levels, I'll get into real trouble now, than the levels identified as being relatively safe. So we've looked at various mechanisms for that. It comes back to my issue about community. If we're always saying to people, you must not do, you can't do, you should not do, the chances are most people are going to say, well, I'm going to do it anyway. We've got to find a way of engaging with people so they understand some of those consequences. Supply of alcohol and licensing laws, where literally 24 hours a day, if you want to, you can buy alcohol, where you can buy it at a price, for £10 you could probably buy enough, in some places, enough alcohol to kill you. So we need to work across education, we need to work across the supply, and we need to work across price on alcohol, and we're doing work on that in terms of whether we can get a political agreement to some minimum unit price for alcohol, which I think would be really important. It is about, for me, it's that engagement with communities and understanding it, but they're also longer term. And this is where we come back to that pressure on the acute end versus how we resource the preventative and the early intervention. And some of those are relatively low cost and some of them aren't. But how we get people to actually recognise that that's what's causing some of their ill health and well-being, I think is a real challenge, because these are those ones with the low life expectancy are also those that engage less. So, they may be in their doctor's surgeries, they may be in A&E, they may be in, in a place where they need to claim benefits, but by and large they're not engaging around some of that preventative agenda. And, it's an age-old problem, but one we've got to crack.
Thanks. You set out some of the solutions, including intervening in the early years, employment, focusing on prevention rather than acute health. And you also mentioned that the money available is likely to reduce. Have you had to make any adjustments in terms of the priorities you've set? We hear of local authorities sort of having to choose almost between whether to prioritise early intervention through children's centres or to give priority to the sort of increasing elderly population.
Yes, we have had to make some really difficult choices. So most local authorities in this area have round about half the money they had in 2010. So there's been a kind of a 50% reduction. My own authority, 51% reduction since 2010. And that drives you to keep the money in the acute. I mean, the number one priority of my own council is to support the most vulnerable. And legally, we have a legal responsibility to do that. We don't have a legal responsibility to have children's centres or to invest in early years. And so when you do have a significant reduction, both the legislative framework, but also the fact that these are people who need our services now, then you are going to prioritise. And everybody knows it's wrong, so I'm not excusing it. Everybody knows that we've got to find a way to reverse that, well, not reverse that trend, but at least find some way in which we can continue to invest. I am hoping that round about now the Chancellor is going to be saying, and here's an extra £2 billion for social care in the Liverpool region.
Does he?
Has it? Fantastic.
There you are.
There we go. So £2 billion, first, assuming it's new money, and that's a big assumption, but let's assume it's new money. What that would enable us to do, actually, because most of us have set our budgets for the next 3 years, but if that is genuinely new money, imagine if we were able to say, well, we can use that to fund the acute and release the equivalent amount to go into early intervention and prevention. That would be a fantastic outcome for that. I remain to be convinced that it's either new money or that we can cope with the increase in demand. But I think if that's the case, then that would be a real great opportunity. But we will always have to focus on that end whilst resources are going down. It's both our legal responsibility and our moral responsibility to deal with the most vulnerable. But in terms of sustainability, it's madness, because we know that all we are doing is storing up those problems for the future if we don't get back down to the early intervention and prevention.
I've been ignoring a questioner over there. I do beg your pardon.
Sorry. I actually live in Seaforth. So
I come from Seaforth.
So that was actually quite sad and very scary to see that, because I've been first hand in our community. First hand, we've had problems with people with mental health, first hand problems with people with alcohol, drugs, and the associated things that come with drugs. You know, and literally that is within 4 doors of my house either way. So, and I think a lot of it is down to a lack of education. A lot of it is down to a lack of these, you know, especially the younger people. They have no idea how to even live on a daily basis. You know, get up in the morning, have a shower, get dressed. You know, even the basics kinds of a structure of a day, with or without work. They don't have that ability, and whether that's because of a lack of support from home, or that home hasn't been a situation that they've ever been into. But there's definitely something that you are going to have to fight against, because this is definitely a what's the word I'm looking for? It's a social sort of
Cultural.
Culture. That's the word I'm looking for. A social culture that is very, very inbred with people. I've had young girls living either side of me, trying to help them out, you know, with whatever they've needed to do. But the repercussions of that have been awful in some situation, have been really, really terrible. And in our particular area, and given, like you say, you know, where I live, 5 mile in the direction, there's a lot of different things that, you know, the council, rightly or wrongly, have taken out a lot of the support, and we're actually known as no man's land for a number of services in the area. Well, not in the area because they're outside the area, obviously, but there is a lot there that needs to be addressed, isn't there? You know, and I think you've got a very big job ahead of you in order to change that, because not only you need to change the perception of a culture, you need to change where that help comes from or how they can get to that help. So a lot of the people, so I would say to them, well, you need to go to Bootle, for instance, or you need to go to Crosby to get that help. They haven't got the bus fare to get to that area, to get that support.
Yeah, absolutely.
You know, it's really frustrating. I'm a bit more upwardly mobile and vocal person, but for other people who aren't that way inclined, it's much more of a struggle. You know, it's particularly a lot of young mums in our area. You know, younger ladies, and it's really hard, and
It is.
and they don't vote.
No.
Because they don't understand, and they don't understand what the repercussion of that is. And even when you kind of try to explain on a more basic level of why you need to do this, because this will have an effect on what is around you, they still don't do it. You know, and partly I think that is because, you know, the councillors don't particularly engage with these people, and maybe because it's quite a safe seat or whatever, I don't know. But I think there needs to be a lot of change, particularly in our area.
A response.
Absolutely. I think there's a range of things that we need to be able to do. I think there are some people who don't do this. I think there are others who actually none of us would have wanted their lives that led to that position, to where they're unable to you know, to have that structure to their day. So there's a whole load of, right from before they were conceived, let alone when they're trying to hold down a tenancy in challenging circumstances. So there is a whole range of those things that need to be tackled. But let me just tell you quickly a little story. Outside Bootle Town Hall, where I spend most of my week, there's a hostel for those people recovering from drug addiction. A couple of years ago, I invited them into the town hall because I wanted to understand what their pressures were, what we could do. And I have a bit of this phrase, and I say, if I had a magic wand, what would be the one thing that you would want me to do? And I expected them to say, I want a great house, I want this, I want that, I want a job, or whatever. And what they said to me was, we'd like some bike chains. And I'm thinking, chains? Why would you want bike chains? They need bike chains because they rely on their bicycles to get both to whatever employment they have, or their friends, or their connections, and their bikes keep on getting stolen. So what that means is that they are then completely isolated. Now this is £5 for a bike chain, and we must be spending millions on supporting their addiction. And to me, I'm not saying that's the solution, because that's a very glib, but if we don't understand the needs, and if we don't engage with people, how can we come up with the solutions? Because otherwise, the millions of pounds that have gone, Seaforth has had millions of pounds of government and European money. And you're absolutely right, the benefit of that, the people who have benefited of that probably no longer live in Seaforth. And so how do we get that right balance?
One final question, I think.
Oh, I'm lucky, aren't I, that I crept
Yes,
in
just
there.
yes.
I'm from the Department of Health Services Research here in the university, and we're increasingly wanting to work with communities about the issues that are relevant to them. And have you any ideas about how you actually do that?
Okay. I have. So, my number one tip, I'm conscious of the time, my number one tip is there's an organisation of voluntary and community and faith sectors that cover the whole of those 6 boroughs, and it's called the V6 organisation, and I can give you their contact details, and they are representatives of all of the funded and non-funded voluntary and community faith sectors across the whole of those 6 boroughs. And what they will be able to do is to put you in touch with groups and with individuals who will be able to help.
My word, I had hoped that Margaret's talk would spark a few ideas, and it clearly has. I'm just the burnt-out clinker of a physician, and so I don't really understand social issues or complicated things like how you change culture. You might also ask the question, how do you get to the station from here, except at the moment, of course, there aren't any trains.
There are.
They're back on. So we should thank Margaret for a really stimulating talk. We'll be back on.